What is activated charcoal or activated carbon? Let's find out what's truth and what's myth. Throughout history, humans have used charcoal to purify water or remove poisons and toxins from the air. The reason it works so well is because charcoal is primarily made of carbon. Carbon atoms have a unique ability to easily form covalent or molecular bonds with other elements on the periodic table, and also with other carbon atoms at the same time. For example, the simplest organic compound is methane, which consists of one carbon atom holding onto 4 hydrogen atoms. Carbon can also bond with other carbon atoms, allowing the formation of larger molecules like DNA. We are called carbon-based life because carbon is like the glue that allows atoms to rearrange into complex strings of organic matter. Pure carbon can also be stacked into different shapes and sizes to create structures with unique properties. For instance, graphene and diamonds are both made of carbon atoms. The only difference is that the atoms are stacked differently. So, when Superman squeezes a lump of coal, what he's doing is forcing the carbon atoms into a tighter formation, but they remain the same carbon atoms. With activated carbon, you want the opposite effect. Charcoal is naturally light and porous. To activate it further, an external element is inserted into the carbon structure. Typically, it is treated with steam at temperatures exceeding 300 degrees Celsius, or chemically with an acid-based solution. This process expands the carbon molecules, making it porous or puffy. The element is then burned away or evaporated, leaving the charcoal with a greater surface area. The pores trap gases, poisons, and other microscopic elements. This is why activated carbon is used in air filters. It allows air to pass through while trapping smoke, bacteria, mold, and toxic gases. In the medical field, activated charcoal is used to absorb certain poisons in the stomach that may have been ingested by accident. This method works well because once bonded to the carbon, the poisons cannot enter the digestive system and are not absorbed by the body, instead being naturally excreted. This approach is sometimes preferred over a stomach pump, which can be invasive and dangerous. Activated charcoal can also absorb gases trapped in the intestines and may assist kidney function by filtering out undigested toxins and drugs. Activated charcoal is particularly effective at removing toxins derived from urea, the main byproduct of protein digestion. More research is needed, but some animal studies suggest that activated charcoal may help improve kidney function and reduce gastrointestinal damage and inflammation in those with chronic kidney disease. For instance, a 2013 study on rats with induced chronic kidney disease found that those given 4 grams per kilogram of activated charcoal daily showed significant reductions in intestinal inflammation and damage. Another 2014 study on rats with induced chronic renal failure found that those fed mixtures containing 20% activated charcoal experienced improved kidney function and reduced kidney inflammation and damage. To be most effective, activated charcoal must be taken within 4 hours of swallowing toxins or poisons. Once a poison has been absorbed into the bloodstream, charcoal cannot extract it. It's also important to note that activated charcoal cannot bind to all types of toxins and drugs, especially corrosive substances like alcohols, hand sanitizer, ethanol, Dettol, caustic soda. Iron overdoses, which can happen when children find adult medication or mistake vitamin tablets for candy. Lithium overdoses from bipolar medication. Petroleum products such as fuels, motor oil, paint thinner, antifreeze, and nail polish remover. In case of poisoning, always consult a poison specialist or doctor. Never attempt to treat an overdose at home. In a 2017 review of recent studies on the use of activated charcoal for diarrhea, researchers concluded that it might prevent diarrhea-causing bacteria from being absorbed in the colon. Many teeth whitening and oral health products contain activated charcoal, but unfortunately, there is no research to back up these claims. A 2017 review concluded that there was not enough laboratory or clinical data to determine the safety or effectiveness of activated charcoal for teeth whitening or oral health. Skincare. Researchers have reported that activated charcoal can help draw microparticles such as dirt, dust, chemicals, toxins, and bacteria to the surface of the skin, making them easier to remove. Many traditional medicine practitioners use activated charcoal powder to treat skin infections. Activated charcoal may also have antibacterial effects by absorbing harmful microbes from wounds. Various activated charcoal deodorants are widely available, as charcoal may absorb smells and harmful gases, making it useful for underarms, shoes, and refrigerators. Some even take it for hangovers, although the evidence for this is limited. To date, no significant adverse reactions have been noted with activated charcoal. However, if you're on medications, activated charcoal may interfere with their absorption. It's best to consult with your doctor before using it, especially if you're on other medications. It is also not advisable to use activated charcoal daily, as it can absorb essential vitamins and minerals your body needs to fight infection and disease. Again, consult with a doctor before taking it regularly, just to be safe.